Hello, everyone. Welcome to this audio podcast. In this series, the Excerpts Equipoise chapter. This is the Scientist, and this is another Storm Robotics production. Today, I'm going to provide an excerpt in context of the effect of the renin-angiotensin-aldosterone system the effect of renin-angiotensin-aldosterone system blockade in CKD. And so the excerpt around this is thus. The introduction is that around this is that CKD is an asymptomatic condition which has a prevalence of around 15% in people aged over 35 in the at least in England, United Kingdom, and occurs when there is a persistent reduction in glomerular filtration rate, or GFR. The inhibition of angiotensin 2 of the renin-angiotensin-aldosterone system, or RAAS, by drugs angiotensin-converting enzyme inhibitors ACE1 and angiotensin receptor blockers ARB or ARBs has proved to decrease the rate of decline in kidney function in patients diagnosed with CKD. So the methodology around this was that original research articles or journal articles were searched on multiple databases, including EBSCO, AMED, and CINO, PubMed, and ProQuest. Several key terminologies were used, including CKD, kidney failure, renal disease, RAAS inhibition, ACE or ACEI, and ARB. Studies beyond 13 years, non-English, without abstracts were not included. So the results around this were that multiple research papers confirmed that ACEIs or ACEs and ARBs have been effective, and RAAS has slowed down the progression of CKD, specifically for patients suffering between CKD stages 3 to 5. High doses of ACE and or ARB, along with combination therapy, has been documented as more effective in comparison to single-base treatment regimens. Several studies stated successes in using more effective in comparison to single base treatment regimens, and several studies have stated success in using direct renin inhibition, or DRI, as a RAAS blocker, and combination therapy of DRI, ACEI, and ARB is also effective. The discussion around this is that RAAS blockade therapy has increased the likelihood or the probability of hypertension, hyperkalemia, and cough like symptoms, but the protection of renal function is more important. Has been more important. ARBs are more efficient in comparison to ACEs or ACEIs. Although for a selection of patients, it is the opposite. And so, to overcome the barrier of hyperkalemia, two new recent potassium binding drugs, known to be as sodium zirconium silicylate, and Patrimo, have shown promising success in CKD patients receiving RAAS therapy. The conclusion around this is that more research in RAAS inhibition therapy could bring success in treating CKD patients and reducing the risk of kidney failure and mortality rate. The terminologies around this work or related work are CKD, RAAS inhibitor, ACEI or ARB, DRI combination therapy, and kidney care. And so, in context of acknowledgements, I like to acknowledge Mohammed, and where there was a collaborative effort between an academic institution and the renal patient support group, the RPSG. Once again, this was an excerpt surrounding the effect of renin-angiotensin-aldosterone system blockade in CKD. And this has been another Storm Robotics production.